How to design high-impact implementation research studies. Hey, everyone! Today, we're diving into the how of designing high-impact implementation research studies. Whether you're a health researcher or a clinician wanting to make a real difference with your work, this quick guide will show you how to create studies that drive real-world change. So, what makes an implementation research study high-impact? Here are the key components you need to consider when designing your study. 1. Problem identification. Every great study begins with a clear problem. Start by identifying a gap between evidence-based interventions and their application in real-world practice. What's not working? Why isn't this intervention being used effectively? Defining the problem sharpens your focus and drives the direction of your research. 2. Contextual understanding. Context is everything in implementation research. Understanding the environment in which you're working is crucial, from the healthcare setting to the cultural, social, and organizational factors that will affect the implementation. Spend time analyzing your context and tailoring your approach accordingly. 3. Stakeholder engagement. Engaging key stakeholders is a game changer in implementation research. Involve patients, healthcare providers, policymakers, and other key players right from the start. Their input will help ensure your study is relevant, feasible, and accepted by those who will ultimately be responsible for implementing the intervention. 4. Implementation strategies. Once you've identified your problem and understood the context, it's time to design your implementation strategies. Think about the most effective methods to promote the adoption of your intervention. This could include training, organizational changes, policy adaptations, or even behavior change techniques. 5. Outcome measures. Remember, implementation research isn't just about whether an intervention works, it's about how it's implemented. Define your outcome measures carefully. These might include implementation outcomes like fidelity, sustainability, and scalability, in addition to the health outcomes you're aiming to improve. Implementation research can be complex, but the good news is you don't have to start from scratch. Several frameworks can guide your study design, ensuring that you address all the essential components. Here are a few popular ones you should consider. 1. CFIR Consolidated Framework for Implementation Research. CFIR helps you systematically assess the factors that might influence implementation. It breaks down the process into 5 domains: the intervention itself, the inner and outer settings, the individuals involved, and the process of implementation. This framework is ideal if you're dealing with multiple layers of complexity. 2. REAM, Reach, Effectiveness, Adoption, Implementation, Maintenance. REAM is a practical framework that helps you evaluate the public health impact of your intervention. It focuses on 5 key dimensions: reach, effectiveness, adoption, implementation, and maintenance. This is particularly useful if you're aiming for scalability. 3. PDSA Plan, Do, Study, Act. If you're looking for a flexible and iterative approach, PDSA might be your go-to. It's a cyclical model that helps you test changes, study the results, and then refine your approach. PDSA is perfect for ongoing quality improvement efforts. Now that you've got a handle on the components and frameworks, let's talk about the nuts and bolts of designing your study. Here are some practical tips to ensure your research is impactful. 1. Define your research question. Start with a clear and actionable research question. For example, instead of asking, "Does this intervention work?" ask, "How can this intervention be effectively implemented in this specific context?" Your research question should guide every aspect of your study design. 2. Choose the right study design. Implementation research can involve a range of study designs, from randomized controlled trials to observational studies, or even mixed methods approaches. The key is to choose a design that fits your research question and context. For instance, if you need to explore why an intervention isn't working, qualitative methods might be best. 3. Pilot test your approach. Before scaling up, conduct a pilot test of your implementation strategies. This will allow you to identify any barriers, refine your approach, and make adjustments before full-scale implementation. Think of it as a dress rehearsal for your study. 4. Collect both quantitative and qualitative data. Implementation research benefits from a mixed methods approach. Quantitative data will help you track outcomes like adoption rates or fidelity, while qualitative data will provide insights into the why behind your findings. Combining both will give you a richer understanding of your results. 5. Plan for sustainability from the start. Don't wait until the end of your study to think about sustainability. Design your study with long-term success in mind. Engage stakeholders who will maintain the intervention after the study ends and build capacity within the system to support ongoing implementation. Designing a high-impact implementation research study isn't just about testing an intervention. It's about making sure that intervention actually works in the real world. By focusing on the right problem, understanding your context, engaging stakeholders, and choosing the right strategies and frameworks, you can create studies that make a lasting difference in healthcare. Remember, it's not just about proving an intervention works. It's about making sure it sticks. Thanks for watching.